The first cervical vertebra is called the atlas, and it is called atlas because it supports the globe of the head. The atlas is a ring of a bone. You can see the ring here, and it consists of a pair of lateral masses. These are connected anteriorly by a short anterior arch and a longer posterior arch. And you can also see that it lacks a spine and lacks a body. It does not have a body and it does not have a spine. The position of the body is occupied by the dens or the odontoid process of the second cervical vertebra, which is the axis, and it lies just behind the anterior arch of the atlas, forming the median atlantoaxial joint. Now this is the anterior arch, the shorter anterior arch. The anterior arch has an upper margin, lower margin, anterior surface and a posterior surface. Now the anterior surface, it has an anterior tubercle. It is for the attachment of the anterior longitudinal ligament in the middle and the upper oblique parts of the longus colli muscles on the either side of it. Now the posterior surface, it presents a median oval facet. This is for articulation with the dens of the axis. Now we can see the upper margin, and it gives attachment to the anterior margin of the foramen magnum by the anterior atlanto-occipital membrane, and the lower margin, it gives attachment to the lateral parts of the anterior longitudinal ligament. The anterior arch is morphologically the ossified hypocaudal bow. Now coming to the lateral masses. The lateral mass is weight bearing and presents the upper and the lower articular facets. Now the upper facet, you can see, is deeply concave and kidney shaped, and it articulates with the occipital condyle to form the ellipsoidal atlanto-occipital joint. Now you can see the lower facet. It is circular and mostly flat, and it articulates with the corresponding facet of the upper facet of the axis. Now this, if you can see, there is a tubercle that projects medially from the lateral masses, and they give attachment to the transverse ligament of atlas, which passes behind the dens, separated by a bursa, and retains the dens in its position. Now this is the posterior arch. The posterior arch forms almost 2/5 of the ring of the bone. This corresponds with the laminae of the other cervical vertebrae. Now it presents an upper border, lower border, anterior surface and posterior surface. The upper border, it presents a wide groove just overhung by the posterior part of the superior articular facet. This groove is for the lodgement of the third part of the vertebral artery and the first cervical nerve, where the nerve lies between the artery above and the bone below. Rest of the upper border is connected to the posterior margin of the foramen magnum by the posterior atlanto-occipital membrane. The lower border of the posterior arch It is connected to the lamina of the axis vertebra by the highest pair of ligamentum flava. On the posterior surface, there is a rudimentary posterior tubercle for attachment to a slip of ligamentum nuchae in the middle and the rectus capitis posterior minor muscle on each side. And the anterior surface forms the posterior wall of the vertebral foramen. Now the transverse processes of the atlas. These project from the lateral mass and enclose the foramen transversarium. The tip of the transverse process of the atlas corresponds to the posterior tubercle of the transverse process of a typical cervical vertebra, and the bone in front of the foramen transversarium. It corresponds with the costo-transverse bar or the intertubercular lamella. Its anterior tubercle corresponds with the small tubercle on the lateral mass. So the transverse process of the atlas lacks a anterior root. Now the transverse process, it gives attachment to the rectus capitis lateralis and superior oblique muscles on its upper surface, the inferior oblique at its tip, and slips of splenius cervicis, levator scapulae and scalenus medius on the lower and lateral surface. Now the anatomical position of the atlas, it is the anterior and posterior is known by the shorter anterior arch and the longer posterior arch, and also the anterior arch, it presents on its posterior surface the median oval facet for the dens. Also the above and below, it is known by the articular facets on the lateral mass. The superior or the upper articular facet, it is deeply concave and kidney shaped, whereas we have already seen the below or the lower articular facet, it is circular and almost flat.